टेस्ट करना है. A great man once said, in 1 minute, you can change your attitude, and in that minute, you can change your entire day. With this thought, let's start today with energy infused with positivity and learning. Jai Hind and a very warm good morning to one and all present here. I, Dr. Elizabeth Marathur, Assistant Professor from the Department of Prosthodontics and Crown and Bridge, welcome you all to our guest lecture titled Digital Dentistry Today, Revolutionizing Oral Care under the Subharti Alumni Lecture Series. Before beginning today's session, I would like to welcome our alumni guest speaker, Dr. Shuchi Tripathi ma'am, our esteemed principal and dean, Dr. Nikhil Srivastava sir, head of all departments, all faculty members, and dear students. Now, I would request respected principal and dean, Dr. Nikhil Srivastava sir, to say a few words.
Jai Hind and very good morning to all the attendees and the keynote speaker, Dr. Shuchi. Shuchi, you have been our alumnus and extremely proud of you. I don't know whether you are aware or not that Dental College has one of the best practices with the name of SALS, S-A-L-S, which means the Subharti Alumni Lecture Series. And the very objective of this particular activity is to engage our alumni in our college's day-to-day activities and different kinds of programs of what we offer here. So this is a kind of encouragement and inspiration. You become the inspiration for our students who are studying here, and they should realize that yes, tomorrow they can also achieve the greater height as you have achieved. And the topic which you have chosen is very, very appropriate. The need of the hour and the future of dentistry is the digital transformation of dentistry. So I'm sure when you were studying here, not many digital equipment were here. And I'm also from KGMC, so my time was a little, earlier. So I was there from 88 to 96. So that time there was hardly any digital thing. So everything was manual. But now with the passage of time and the advancement in dentistry, the digital dentistry has the inseparable part of the dental practice of today. And I think all students should know about it. And then when we were thinking that who can talk on this particular topic, so your name was suggested by Dr. Roma. So I'm sure that your lecture will be a great benefit to all the students and all those attendees who are now currently have joined here. So Shruti, once again, on behalf of Subharti Dental College and Hospital, a very warm welcome and thank you for sparing your time and sharing your knowledge and wisdom with all of us. So over to you. Thank you very much.
Thank you so much, sir. Before proceeding with today's guest lecture, I would like to introduce the guest speaker for today. Dr. Shuchi Tripathi ma'am is presently serving as the professor in the Department of Prosthodontics and Crown and Bridge in the prestigious King George's Medical University, Lucknow, India. She has around 16 years of clinical experience with special interest in temporomandibular joint disorders, maxillofacial prosthesis, occlusion, and dental education. She is a fellow of the International College of Dentists, Pierre Fauchard Academy, and Academy of Dentistry International, Indian Society of Dental Research, and the member of National Academy of Medical Sciences. Presently, she is serving as editorial member, reviewer board member of more than 15 journals. She is the author of around 60 journals, book chapters, and has more than 500 citations. I want to request, ma'am, we are honored to have you with us today. I want to request everyone to kindly write their queries in the comment section with us, to which our speaker will answer at the end of the session. Thank you.
Hello, hello, Elizabeth and Nikhil sir, Roma ma'am. Very good morning to you all, and very good morning to all the dear students. It's my pleasure to present my this topic. Actually, it is quite dear to me because I have done a project also on digital dentistry. I have prepared a module on it. This was a part of project in my. I have completed my master's in health professional education. So in that thing, it was a part of my project. So what I thought that now today it is the day of digital dentistry. As Nikhil sir has also addressed that yes, it in our times it was not so in, and we were just we were just on the internet only. We could able to see it. Right now you have mobiles, smartphones, and again the digitalization is so much in that whatever we say, you just Google it and just see it. But at our time it was not there. So I was just thinking that are we running behind somewhere, somehow? So we should be actually keep a pace, same pace with our student, and there is a need to introduce the digital dentistry. That's why this was the topic I chosen for that. And rest is all. You have to just see it and then let me know. Whatever the questions you have, I'm ready to answer it.
A very good morning to you all. I feel proud to present my lecture for my alma mater, Subhati Dental College. And I dedicate my lecture to my teachers, to my respected teachers, Dr. Himanshu Aaron sir, Dr. Sanjay Yadav sir, Dr. S.P. Singh sir, Dr. Sood sir, Roma ma'am, Neelam ma'am, Nadeem sir, and Rima ma'am. Thank you so much, all my respected teachers, to support me and guide me whenever and wherever I needed it. My present lecture is on digital dentistry, revolutionizing oral care. And as you know that now the digitalization is there in all the fields, and it is encroaching almost every aspect of our life. So dentistry is not at all untouched with it. I must say that if you look at wherever you look at, you will find the digitalization in it. So first of all, I would like to say that whatever the pictures and images has been used in this presentation, they are mainly for the educational purpose, and I don't have any conflict of interest regarding this presentation. Now we talk about the digital dentistry. Whatever we are learning in today's time, yes, some of the aspect has been taught where digitalization is there, but if we will look at after completing our dentistry, we will see that now even if we start our practice, it is there only. So when you complete or your graduation or post graduation, you will go to the practice. So for practice management, there is digitalization. We have some apps which actually manage the patient appointment, manage the patient history taking, or their investigations, and whatever the treatment protocol, diagnosis part, whatever it is there in the app. So, along with that, if we go for the investigation of the patient, there are some radiographic or the diagnostic tools which is used in digital dentistry, which will accurately tell what kind of disease it is. And then definitely it will help in the treatment planning to education, if we talk about whether it is for the patient or whether it is for the student, for your learning. It is actually there. And from the COVID time, you must have noticed that yes, if there is no digitalization, the education would have not been possible at all. So everyone have been familiar with digitalization in education, more familiar during the COVID time only. Then if we talk about the various restorations or the surgeries, you all know about the nanotechnologies, you all know about the robotic surgeries, and whatever the advancement is going on. So CAD CAM process, which is actually helpful in providing getting a better surgeries done, and then restoration or the prosthesis made. So then definitely there is the diagnosis of and this whole of the things includes the diagnosis. So in the very earlier phase only, the diagnosis of the patient, yes, the digitalization is there. So if we will see the workflow of the digitalization, we can see as a digital patient. So digital patient, whatever the data is taken in the form of the picture, in the form of the X-ray, in the form of some radiographic investigation, histopathology, it is all has been digitalized and can now be stored or archived in the patient's digital record. So there is a virtual patient where the mental planning of the patient rehabilitation, which is assisted with a digital treatment planning and on-screen simulation by using the computer aided designing. Then there is a real patient. After this CAD, the machining process involved, which makes a real prosthesis, or by using either milling or the 3D printing technology, which can be used on the patient. So now coming to the practice management, if we talk about, we will all go all these details one by one. So if we talk about the practice management, we know that there is a calendar management comes first, patient's appointment, then communication. If we are appointing the patient, there should be a regular, very accurate way or the very precise way to deliver these things. So either through email, SMS, letters, and there are reminders for the patients as well as for the dentist. There is telehealth video calls. Then we know that now the telemedicine is there and appointments are there. From a distance only, we can actually deliver our things. Client management through the various appointments, their payment and invoicing system, their online booking, reports, various reports has been now saved as and we can use it for the future use also. There are some clinical notes about their diagnosis, their treatment and the investigations. So as this is all, we can say there is a robust integration of all these components when we see about the practice management. And for practice management, there are various apps available with it can be free or paid, like Practo, Caspio, Accountable, QMinder, Simplex, Simplex Practice, Clinicia, all. There are other so many practice management tools available which you will see whenever you will Google search. Then the patient management. So the patient is now there, and you have diagnosed the patient. We have prepared some treatment planning, and then now you want to deliver your aspect. So for that, there is a patient management tools are also there. Earlier, it was not possible without digitalization because we cannot show whatever the future, what comes in the future or what is there after the processes has been made. But now there are various tools which will show after the prosthesis has been made and fitted in the patient mouth, and then you can show it then and there only. So if you will see that you can educate the patient very well by using these digital tool, where there are various education tools also, dental patient education, chapter 2 dental applications, and dental 3D illustrations and others. There are so many like available apps which you can use for educating your patient. So for the education also, for the education of the patient also, we can use this education tool. There are some 3D visuals, interactivity to create a one-of-a-kind resource for the modern dental students. It is uniquely uses augmented reality with interactive, intricate, anatomical and realistic models for the individualized learning, and it also includes the games and dental study resource design in where the key dental treatment has been done, and a wide scope is there from beginner to the advanced learner. So if we will see, there are various diagnostic tools available. There are some scanners, intraoral scanners, extraoral scanners. For occlusal analysis, there are T scans now, and for pulp vitality test, there are some digital equipments available. So all these digitalization helps us to make a precise diagnosis now, which was earlier done only by the cast or the photographs. So there are various, if we come talk about the investigations, there are various digital radiographs and softwares which are associated with RVG, OPG and CBCT, cone beam computerized technique. T-scan is a computerized occlusal analyzer is there, which actually very well accurately measures the occlusion of the patient. And then there are some histopathology of the histopathological report, which is now digitally available. And everything can be seen sitting on the chair. Just a break. So these are the pictures of my pictures of the visits of my teachers and my friends during my in my college where I'm presently working, the King George Medical University, and I'm sure you're aware with these people here. So after we have talked about the diagnosis, we have also talked about the various practice management tools, education tools, and about the investigation tools. So for the investigation or diagnosis, again there is a scanners or the digital photographs available. It can be intraoral or the extraoral. There are some cameras also which takes which gives you a 3D view, which takes the pictures at various level, and then it is getting combined and to provide a 3D view. So when you will see, if you want to see the details, you can always search for it, and if you want any link for it, I will provide it. So there are various tools which will be actually there are some scanners, 3 shapes scanners, triodes scanners are there, which is used for scanning and then sending it to the laboratory where the further process is being done. So there are some digital smile designing, mock-up and expected post-op results. If you will see after this smiling designing, we can get the post-op results very nicely. There are various softwares for analyzing various digital radiographs like ImageJ and Radiance are there, which will precisely tell you about the findings. And there are some smile design softwares like Panmica, Romaxis, Smile Designer Pro, which will actually take the picture and then further the designing is there in various formats, and then the final mock-up and which can be shown to the patient, and then the delivery can be done very well. Okay, that there's earlier it was like shade matching was done by using some shade guides, but now digital shade matching is done where there is digital spectrophotometer for color matching is provided, and by using these digital shade matches you can very well predict the color of the crown what you need. actually. And also, if we talk about the maxillofacial prosthesis, yes, these spectrophotometers are there, which accurately tells the amount of color which will be provided to the prosthesis during the fabrication process. Now there are some T-scan and virtual articulators, and these T-scans and virtual articulators mainly helps um, in the telling you the type of occlusion where the correction is required, along with aligning both upper and lower jaw virtually on the computer. So we know that if we will talk about the articulators and we talk about the relation recording, it is how much it is cumbersome when we are doing it. But yes, with this digital process, you can very well record all these minor things. And if we talk about the temporomandibular joint problems, so for recording that or for the correct diagnosis of their joint vibration analysis, the electromyography technique, and there are some joint trackers also, which will actually precisely locate the upper and lower component. Where is it? Where the problem is there? If there is a space, lack of space, or there is some bony prominence, whatever it is there, along with that, how the movement is going to be performed, this all has been recorded very well with these digital tools. Now coming to the surgery, if we talk about the surgery, we know that digitalization is still there. Now there is some uh, computer controlled local anesthetic delivery system is there, which is very precise. There is digital evaluation of skeletal malocclusion, pre and post orthognathic surgeries are there. And there are some surgical guides or stents through additive and subtractive manufacturing process. And also there are guided surgery through the computer process. Um, Robotic surgeries are also there for enhancing the skills. Now, if we will see about mm, our specialty, there are some restorations, stents, and prostheses are being made through the CAD/CAM technology, and these are very precise and accurate in their coloration and the fitting. And nowadays, it is commonly practiced everywhere. This is a workflow from modern open architecture CAD/CAM system, if you will see. So, starting from the patient consultation and review, we can have an intraoral scan from the patient directly, or the pictures has been taken from the patient, or we can have a cast picture, those scans, desktop or other scans, impression or stone model um, cast impressions which has been used as a picture, and then we send it to for the designing software. And after the designing software, the patient photographs or CBCT are also used, and we can use it in a 3D model. And then with this 3D model, the designing is then proceeded with. We will plan the type of prosthesis or the restoration, and when it is being planned, now through the milling or the printing process, these things are finally we will receive, and this is getting delivered to the patient now. Now, if you will see that there is some chair side milling technique also, and the crown or FPD can be delivered within an hour when the patient is sitting over there. And now, if we will talk about the digital dentistry and its other application, during the education only there is a virtual reality and augmented reality. Virtual reality will be fully enclosed synthetic experience with no sense of real world. However, if we will talk about the augmented, this virtuality will be actually connected with the real life, and the student will feel like he is actually doing a live surgery. So this will again give a very minute control on the hands for the increased skill. So these kind of things are there. Haptic softwares are there. There is finite element analysis now, where the computerized forces are present on the restoration, and then the kind of forces transfer and tension or the stress or the compression which has been being transferred, we can note it very well via the computer system before going to the real world. There are some robotic surgeries, if you can see. So all and if you talk about the education, then online surveys are there. We have a digital communications through using various apps. There are some various very good tool for the education like Zoom, most commonly used. Then the Google Meet is there, and Skype, and I will actually thanks to the digitalization that I am here from Lucknow. I'm talking to you from here, and then you can very well go with my presentation because of this digitalization only. So again, like teledentistry, we have already talked about. This is all there to support us and to strengthen us. Now, these are my various awards in my field. I just cannot forget, this is my first award received from Dr. Himanshu Aaron sir during my PG time as a first best paper award in R&R hospital. And now I have received many awards, mainly from the, if this is the award taken from the my guide, Professor Tanaka, and also I have done my CCHP course, I have received my fellowship, and also I have received in a course in the award in Japan. So all these things are there. Now coming to the advantage of digital technology. Digital technology, if we talk about the advantages, it is highly accurate and precise in nature, and predictability is very high. If we see, it is quite efficient method, whether in any kind, like it is whether it is diagnosis, whether it is various other fields also. There's no need of provisional restorations also. So because then if you will think about, then it is reducing our cumbersomeness. Then the time needed for taking a digital impression is less than that is used for the conventional impression. And if we talk about the storage of data, yes, it is there. The data can be stored for a infinite time, you can say, and it can be retrieved whenever, wherever it is needed. It is also very useful in remote places where laboratories might not be readily available. So we can record, we can take a scanner, we can use the scanner, get the pictures, or we can send our cast to the remote places, and from there we can send it to the either to the Delhi, Mumbai, anywhere, Pune, and from those laboratories it is being prepared and then send it back to us. So you can see that how the efficiency is getting improved because of this. Then there is implementation of the telehealth. Yes, even from the distance also the patient is not able to reach, and in COVID time also this teledentistry or the telemedicine, we can see it is very well used and has been implemented. So if we talk about the digital technology, it is very much comfortable to the patient also. So many cumbersome process has been reduced, you can say that there is a less clinical time, less, and the visits of the patient, making him more comfortable. Pre-planning of the treatment can be done, and visualization of the outcome can be very well done with the using this digital technology. Then there is a virtual simulation of the procedure. We will see the virtual simulation can be done very well using the computer and using those various apps and softwares. We can also use it for the training and the education program and streamline processes that can be cumbersome via the analog way, as I've already discussed, can be very well done with using digital technology. So coming to the disadvantages, obviously whenever there is some comfort, there is always some of the problems or some lackings are there. So if we talk about the disadvantages, there is high initial and maintenance cost. We need to change procedures that practitioners have learned in dental school and become used to. Whatever we have learned till now we need to change, and as we are heading towards the digitalization, we need to change it and we need to adapt the modern technology. Um, then there is a patient data privacy rules and regulations also, because there is leakage of these data, and it is like privacy issues are there. So we have, but it can be only done when the storage is done using some password protection and all. So as we say that whenever we do something new, we have to learn it first very well, and if we are not going to learn it, then it is not going to help us at all. So yes, lack of standardized flow workflow, and it is only because that lack of standardization is only because there is a lack of knowledge. And also if we will talk about the infrastructure, it is less here. So as the things will improve, these things will also going to improve with time. There is limited access to digital partner. In India, yes, it is there, but we can see that now with the digitalization, we are improving day by day, and certainly this will not be an issue later. So, if we will talk about the challenges and issues faced. The big data. We know that if we will record the data from the beginning for one patient till end, and there are various patients, so we have a multiple of data stored. So whatever the issues are, there is the issues of safeguarding these data security, employing the storage, sharing, and use of data. There is risk of data manipulation and falsification is there by using the digital dental radiographs, and these all can be reduced very well by using the data protection. And I would like to emphasize again, as until and unless we are aware and we know the things very well, we are not able to rectify the problems. So there is dental practitioner and the patient relationship. um, as with time, as we are getting more and more aware, this thing is getting reduced. Threats to the dental practitioner, which was traditionally directed patient relationship due to integration of digital technology into the workflow. Again, this is again because of the lack of awareness. So the workflow system has to be maintained by using proper awareness amongst the dentist as well as the patient. Then there is a digital literacy. Digital literacy is required nowadays, whether it is for the patient, whether it is for the dentist. So, being a dentist, we have to be first aware of it. We can make the patient aware with certainly with their diagnosis and treatment part, and then the things can be improved very well. Assumption of responsibility in complex technical system. So there is a diffusion of responsibility, difficulty to attribute responsibility to an individual in the case of treatment errors resulting from the use of complex technical system. And this can be definitely be reduced by using various measures. Changes in professional profile and self-image. So there is fear of a fundamental change in both the self-image and the public perception of the dental practitioner as much as these digitalization is getting involved. There is a cost trap, over treatment, shift of the standards. So yes, definitely we are now running on the traditional way, and we are shifting to that. There is a shift in that standards, and we have to maintain very well by using and by being aware with these technology. Consumption of spiral and ecological fingerprints of digital technology. So continued digital innovation and equipment's replacement leads to consumption. Consumption spiral or ecological fingerprints. Concerning the disposal of discarded digital equipments. So this has to be taken care of. Lack of clinical evidence. There's a lack of clinical trials in many digital technology in dentistry. This is known as the evidence gap, and which can be definitely done with using more and more applications of digital technology in the near future. So these are my references, various references which I have used during this presentation. If any of you need some of the references, you want to learn the digital dentistry, just let me know. My email ID is dr08shuchi at gmail.com. You can send your queries to me and I'll be there to respond to it. So this lecture is not at all going to be complete until unless I uh, I show this picture to you. All these pictures are during my post graduation in Subharti Dental College. There are some conference somewhere in Delhi and Rishikesh, and in our own in alma mater, Subharti Dental College. These are my seniors, teachers, and my dear juniors.
Thank you so much, ma'am, for such an important and encouraging lecture. It was a very, very important topic, and the way you explained it was so, so very beautiful and insightful. How digital dentistry is playing a major role in providing an advanced and time efficient dental treatment. I am extremely sure that all the participants, especially your students, must have benefited from this, and they will surely incorporate digital dentistry in their practice. I would now request Dr. Shuchi Tripathi ma'am to kindly answer the queries that were posted. The first query that was posted is what is the possible advancements that we can see in digital dentistry?
Hello, Elizabeth. Actually, someone has come. Okay, someone just entered in my room. So, few disturbances. You're talking about a possible advancement in digital dentistry, right? Um, I just missed one point, that is the artificial intelligence. And as you know, that artificial intelligence it's all so much into it. Whatever I had talked, there is somewhere, somehow, someplace, artificial intelligence was there. And again, अगर आप बात करोगे कि what is the boundary of artificial intelligence, I think nowhere. So we that this is just a limitless thing. We all have to learn this digitalization. We all have to learn this artificial intelligence. आर्टिफिशियल इंटेलिजेंस भी जितनी मैंने सारी चीज़ें आपको बताई हैं, वेदर इट इज़ प्रैक्टिस मैनेजमेंट, वेदर इट इज़ डायग्नोसिस, इन्वेस्टिगेशंस, CAD CAM process, whatever, it is all there into it. But now टिश्यू इंजीनियरिंग में भी अगर हम ग्राफ्ट प्लेस कर रहे हैं, there is also now it is very much guided by this. So guided grafting हो रही है और we are producing that, whether it is organ या फिर कोई भी segment है tooth का, and even the natural teeth is now grown in the labs. There are some reports. However, it is not still very much into the practice or very much in but yes, the work is there.
Thank you, ma'am. Ma'am, there was one more question that was posted, which is how will machine learning affect dental professionals in the future?
This is again a question related to the artificial
Yes,
intelligence.
ma'am.
Machine learning, we have to learn because, as I have emphasized during my presentation also, if you're not going to learn it, if you're not going to accept it, we will not be able to process it. So, if we are learning the machine learning, this is again a type of what we are going aware with your system, and then it will improve your proficiency, it will improve your efficiency, and it will definitely increase the betterment in dentistry in India.
Yes, ma'am. Thank you so much for answering all our questions and giving such an insightful presentation. Now, I would like to request our respected head of the department, Dr. Roma Goswami, ma'am, to kindly say a few words and present our guest lecturer, guest speaker, with a certificate of appreciation.
Very good morning and Jai Hind to all. Uh, Thank you so much, Shuchi. It's been a wonderful lecture, and you have provided insight into the world of digital dentistry. And digitalization is actually the need of the hour. And it is always a pleasure to listen to our alumni. And thank you so much. And now we'll be presenting you the token of appreciation on behalf of Subharti Dental College.
Thank
Thank you.
you. Thank you so much, ma'am. It's really a great pleasure for me to be here. Thank you.
Thank you so much, ma'am, for your kind words. I would like to extend my heartfelt gratitude to our guest speaker for taking out her precious time to be with us here today. I would also like to take this opportunity to thank our respected principal and dean, Dr. Nikhil Srivastava sir, for always acting as a guiding light and encouraging us to organize such mindful sessions. Also, I would like to acknowledge our head of the department and all the faculty members of the department for their valuable guidance and support. Lastly, thank you all for patient hearing. Jai Hind.